We are so glad today to welcome Tricia Catiggay. She's an occupational therapist at Stanford Healthcare, and she is going to be talking to our group today about fall prevention and a great program at Stanford called Farewell to Falls, which a lot of people do not know about and really should know about, and also a wonderful community-based program that Stanford coordinates, which is called A Matter of Balance. So take it away, Tricia.
All right. Well, thank you everyone for having me here. And like Robin said, I'm going to be showing a presentation on fall prevention and what we can do to mitigate some of these risks. I will talk about the different programs that our department offers, and Farewell to Falls is one of them. We also have Matter of Balance. We have other evidence-based programs such as Bingo Size and Stepping On. So I'll be going over those a little bit in depth. So I'm going to go ahead and share my screen here. And okay, so let's see. Oops, I want to go back. How do I
So
do
you
that?
just hit the
Okay.
backspace. Yeah,
Oh, wait. Sorry. Yep,
that's all right. You should just hit backspace till you get to
backspace.
the beginning. Yeah.
Okay. Hold, hold on a moment.
And
Yes. Okay.
let me just say to everyone, Tricia has asked that we hold questions until the end, which only means that I'm going to hold questions until the end. As soon as you think of a question, please put it into the Q&A box or the chat box, and I will ask them at the end. Thanks again.
Yes, thank you, Robin, for reminding me about that too. All right, so without further ado, let's go ahead. So I wanted to talk a little bit about the facts of fall prevention. Um, just want to move that a little bit. So among older adults, falls are the leading cause of injury, death, and the most common cause of hospital admissions due to injury. And it's reported that 1 in 4 adults had a fall in 2018. So that's about 36 million falls. But what I've been hearing lately, that number has gone up so that it's been 1 in 3 adults have had a fall recently. And 3 million of those people unfortunately required medical attention. So you'll see there that the cost of non-fatal falls in 2015 was 50 billion, and it's anticipated by 2030 that the cost of treating injuries caused by falls is projected to increase to 101 billion. So that is so significant. And it's good that we are talking about this. 95% of hip fractures are caused by a fall. And you'll see that there are other consequences, including traumatic brain injury, which is a really big one, spinal cord injury, spinal fractures, chronic pain, fear, and debility. So it's really scary stuff. But we do know that falls do happen. But if we can identify the risk for falling, then we can reduce those risks. And falls are not an inevitable result of aging. I mean, I've heard in the past people have told me, well, we're getting older, we're on the way out. Um, Falls are going to happen. But yet they could happen, but they are not because we are getting older. I do want to talk about why is it that we do fall? There are intrinsic factors and extrinsic factors that put into play of why we fall. And you'll see here in this diagram that that they do all intersect, that falls can happen for a number of reasons. And so you can see there environmental, which are the obstacles, lighting, slippery sidewalks, cracks on the sidewalk, curbs and stairs. There are behavioral reasons on why we fall. Maybe we don't exercise enough, or we use medication improperly, we don't sleep well, Perhaps we have improper footwear, substance abuse, such as maybe the overuse of alcohol. Then you'll see another reason why there are biological reasons. Maybe our vision is not as good. There are gait disturbances, weakness, possibly our blood pressure may not be monitored well. So with the orthostatic hypotension, we may have postural instability and disease process going on. And last, there are demographic reasons on why we fall. With gender, they say that men fall more than women, but they don't report it as much as women. Age, so over 65. If you had a history of falls, you are more at risk for falling again. And then there are socioeconomic factors too. Oops, sorry. So what do we know works? So this is what works, is having a medical assessment and to make sure you tell your doctor the symptoms that you're having because your doctor will investigate with you. They're a team, part of your team in keeping you healthy. I had someone tell me that, after he heard about some of the of risk factors as far as not telling your doctor everything, he went back to his doctor and told him, well, I'm also having this symptom going on. And his doctor said, oh, I'm so glad you told me because I've been treating you for the wrong thing. I want you to stop the medication that I'm giving you, and I'm going to refer you to a specialist. So it is really important to be frank with your doctor and tell him or her everything. What's also extremely important, and I'll go over this a little bit more in depth, is make sure you have your vision checked on a regular basis. As we get older, our eyes don't process light as well as we did when we were younger. So it is really important to have your vision checked. Of course, looking at your medications, because you know that medications have side effects, and some of these side effects could cause someone to fall, like lightheadedness or dizziness. And sometimes there are interactions with other medications, and even with some of the food that you eat, or with some of the over-the-counter or herbal medicines that you may take. So it is really important. And again, we'll go over a little bit more in depth with that. Home safety assessment, modification. So making changes in your home so that it's a much more safer environment for you to live in. And of course, practicing safe behaviors. Sometimes we have faulty behaviors like maybe not paying attention to what we're doing, trying to do too many things at once, trying to carry too many things while you're going down the stairs. I mean, I'll have to tell you, I know of so many people who tell me they park their car in a parking space and there's that I don't know, that curb that hits your bumper if you go too far. I've seen so many people. And in fact, I myself have tripped on those bumper things and almost fell. And I've known of people who have fallen. So practicing safe behaviors, and of course, last but not least is physical activity. And what I'm going to do in the course of this afternoon is go over those in a little bit more depth. Okay, here's vision. So changes in our eyesight can cause problems, especially with glare. So um, I've known people who will tell me is coming from they're going into their doctor's office and it's bright and sunny. They come into the office and then there's changes that their eyes have to make adjustments for. So there's that light dark contrast. So again, getting your eyes checked on a regular basis. I think also too, I read something about certain medications can cause dry eyes, and so again, that will affect your vision. So vision is so important um, to observe obstacles in your way. If you can't see it, you can't avoid it. So again, vision is very important for your balance. I had one guy who he had a tendency as he got up from sitting to standing to close his eyes. And I said, oh, no, no, don't do that because we rely on our vision a lot to help us keep our balance. So it was part of the education for him. And also multifocal lenses can increase fall risk. So if you wear bifocals or trifocals, the changes in where you're stepping on, going up and down stairs. You've got to be very vigilant about that. Medication. So here's the statistic that as many as a third of all falls in older adults may be related to medications. And what's really interesting to me is that four or more medications can increase your fall risk, and that not only includes prescription medications, but that also includes any over the counter that you take for pain, like Tylenol, Advil, any vitamins that you take. And you'll see in the next statement there, even herbals. So, turmeric, echinacea, St. John's wort. Those are things, if you are taking them, make sure that you take them to your doctor or pharmacist to have them reviewed because there could be some interactions with these medications and your prescription medication. Home safety. So more than 50% of falls happen at our home. So you'll see right there, there is a rug that is crumpled up. And sometimes I do home safety assessments, and I say, put a non-skid rug there, replace that. I've had people say, well, I've never tripped on that before, but I don't want there to be a first time, right? You want to remove clutter and cords in pathways because those are tripping hazards. Make sure your rooms are well lit. Again, with the vision, we don't process light as well. Um, so it's good to have lights, night lights, and I'll talk a little bit more about that. Check each room in your home to make sure that it's a safe environment for you. We are so familiar with our homes that sometimes we forget, and that's why you see that more than 50% of falls happen at home. And a lot of these risky behaviors or places in our environment are very easily changed. Like I had one guy who told me that he went on a trip and he came home late at night. He had his luggage. He put it in the hallway and he thought to himself, I really should put it away or tuck it away in another room. But oh, I'm so tired. I really want to get to bed. I'm going to remember that piece of luggage is there. And what happened the morning of, he was rushing to go to the bathroom and he tripped over his luggage. So if he had taken and he felt and we feel bad sometimes. You go, oh, I should have known. And he said, oh, if I'd only taken the few moments to put that away. But that's what happens. It happens in a split second when we fall. Um, Make sure you install grab bars in your shower just to make sure you steady yourself because you want to be able to hold on to that grab bar. Let's say you're standing and you're washing your hair and you're going to close your eyes and scrub the shampoo out of your hair. Something to hold on to. So I wanted to I put this slide in there and I actually have several slides of different kind of hazards. And I want you to take a look at what are the hazards in this bathroom and what you would do to reduce that risk. So, what you might see that under the sink, there's a towel that's crumpled up. There's a hair dryer that has the cord strewn on the way to the toilet that's in the back there. It might be kind of hard for you to see, but there's a towel that's underneath that shower tub combination, so it's a little wrinkled. And there's also, if you see to the near the top of that towel, maybe a little bit more to the right, there's a scale, one of those old-fashioned scales. So that impedes a clear pathway into the shower. And if you peek into the shower, you'll see it's a smooth tub. There's no bath mat and there's no grab bar in there. So these are the things that we want to be careful about in our own homes because is you can easily fall. All right, so let's take a look at another room here. Okay, so here's the kitchen. So tell me, or you don't need to tell me, I won't hear you, but think about what are some of the hazards here and what you would do to reduce it. So I think the biggest thing that I see is this person, actually, which is myself, standing up on a chair. And how often do we do that because it's just more convenient? So you want to have a sturdy step stool, one with a handle that you can hold on to. The other thing, what I would do to reduce some of these risks is the things that you use the most to put them within easy reach and not have them up high so that you would have to, get up and down the stool. The other thing that's always interesting to me is if you must get on a step stool, again, make sure it's sturdy with a handle, don't get out up on the top step and make sure that when you're doing your reaching, that the item that you need to get is within eye level. Because if you um, extend your neck upward and hold it there for an extended period of time as you try to get items out of your cupboard, we have carotid arteries that are on the side of our neck. And if you extend your neck and hold it there for a period of time, think about that's like a kink in the blood flow uh, uh, um, on the side of your neck in those carotid arteries. Like if you think of a garden hose that's kinked, and if you kink it, the water doesn't flow as well. So same thing with this. If you have your head or your neck extended for an extended period of time, sometimes you may get a little lightheaded or a little dizzy, and that's the reason why. So again, I would really advocate those items that you need the most, keep with an easy level, or have somebody else obtain the items that you need. Also in this kitchen, you'll see that there's newspaper that's on the ground. I know of people who maybe they're frying chicken or something like that, and they like to put newspaper on the ground so they don't want to have the grease go on the floor. So they'll do that. What should be there is a rug with a non-skid bottom. And again, I don't know if you can see in the picture, but in the back, by underneath what is the dishwasher, there are some pet bowls. So that would be in your way if you would be cooking in the kitchen. So that's a tray with water and food bowls. And to the right of that, I think there's a rug there that's a little askew. So that was a rug that was kind of like a rag rug that didn't have any non-skid on the bottom of that. So you do want to replace that with a rug with a non-skid bottom. And I see there's a trash can underneath there. So again, that's impeding your progress. The pathway is not clear, so that needs to be moved. So those are the hazards that's in this kitchen. Okay. So let's check the next room. So this is the living room. What do you notice there? So the first thing that stands out in my mind is that cord, that extension cord. And that's right in that pathway. What's also in that pathway of those pair of shoes, you'll see there's a newspaper that's on the floor. I guess someone was uh, reading at that chair and they're done with the newspaper, so they throw it on the floor. The other thing is you'll notice that the pathway between that orange couch or that orange sofa and that chair, it's kind of narrow. So it's kind of a tight spot. So I would kind of move that apart a bit just so that it's a better access. And the other thing that um, I noticed that you see how at the end of the room on the left there's a lamp. So you want to make sure that whenever you enter a room, especially when it's dusk or nighttime, that you're able to turn on the light at the entryway and not have to walk into the room to turn on the light. Walk in the dark to turn on the light. It's really interesting. Um, there was something that I learned about, if you ask people what the most hazardous room in the house is, a lot of people will say the bathroom. And that I mean, it is a scary place because if there's water, there's a way you can slip in there. The surfaces all are hard, and really hurt yourself there. But you know what the number one is, the living room or the family room. And this is the reason why. So you go into your family room, or let's say or your living room, and you sit in your easy chair, you watch TV, and maybe you fall asleep in the chair while watching TV, and now you wake up and realize, oh, I've got to use the bathroom. Or I need to turn something off, or I need to get dinner started. And maybe because you've been laying there for a while, you're a little bit more stiff. Maybe it's gotten a little dark, so it's a little dark. And so this is where a lot of people will fall. So your living room um, and family room. So I think I don't know if you all can see any other hazards, but those are the ones that stick out to me. Okay. Oh, wait a minute. Okay. I thought there was another hazard. Oh, all right. I thought there was another hazard. Maybe it's later on in the presentation. So you'll see that simple changes can make a difference. And you'll see there that on the picture on the left top, there's railing that can be put down because there are stairs there, and they look like they're hard cement steps. You'll see grab bars are great to have. And usually when I tell people about putting grab bars in, um, if you it, to if you install grab bars or have someone install them, try to get a grab bar that has a textured surface rather than a shiny surface. I've had people tell me that, oh, I still feel that the grab bar is a little slippery, so um, I use a wet washcloth and I'll hold on to the bar. But if you have a textured surface, so one, like little cross hatching marks, then that will keep your grip more steady. And so you'll see there are examples in this bathroom where at that middle picture where you can just step right in. There's a chair that has a back and has adjustable legs, grab bars around. And then you'll see on the right, Wendy, she has a night light in the hallway so that if you have to walk down the hallway. Now, a lot of times people will tell me I'm very sensitive to light. I really can't sleep if there's a night light in my bedroom or if there's one in my bathroom. So I've told people, or other people have told me what they use is a motion detector light. And I think I had a friend pick up a pack. Oh no, she went on Amazon. That's right. And she was able to get a packet of 6 night lights that were motion detected, and she said they're wonderful. And you'll see on the bottom again the bath mats. I've had people tell me, like I went to a home for a home safety visit, and they had a really nice rug that they had gotten during their travels, and they wanted to be able to still use it. And it didn't have, they they didn't want to put anything underneath it. So that what their solution was to put it up on the wall, and that was a way to enjoy it and not have to step all over it. So, okay. Oh, also tripping hazards are our pets, right? Their water dishes, their toys. So I had one lady who told me she had a little dog, and one time she was washing dishes and she didn't realize that he was a little Shih Tzu. He came up behind her, and she almost tripped on him because he was right behind her. So one of her solutions that she did is she put a bell on him, just like a cat. So then she would kind of know where he would be. And so that really worked for her because he would commonly come up close to her, and she just needed to be very careful that she didn't want fall on him and hurt him or hurt her. And the same woman told me too that he would sleep with her in the bedroom, but he would be in different places. Like she had like different little doggy beds, sometimes at the foot of the bed or the side of the bed. And sometimes when she had to get up at night, she wasn't sure where he was and wanted to make sure that she didn't step on him. So what she did too, along with his bell, she put one of those glow in the dark collars on him so that she would, once she got up, she would know where he was. So I thought that was really cute. But pets are part of our family, but we want to keep them safe and keep ourselves safe when we interact with them. Okay, personal habits. So these are things like improper footwear, climbing on chairs, and using tall ladders. And these are other behaviors that can increase our fall risk. I know summer is coming, and a lot of people like to wear sandals, or I should say flip-flops. So it's really important to make sure that if you do have summer footwear, to make sure that there is a supportive back or a strap to keep your foot in. I know I'm notorious for this. I love to have flip-flops. And one time I had a pair of flip-flops that they were on sale and they were very cute. And I really didn't want to get rid of them, but I noticed as I was walking in them that my foot would slide and I would kind of lose my balance. And it was hard, but I decided to throw them away. Throw them away. Yes. So because you think about, what's the cost of if I fell and really hurt myself. And that's what I tell some people too. I mean, they tell me, "Oh, it's really hard to get a good pair of shoes. They're very expensive, and it's important that when we do wear to check our shoes on a regular basis to make sure that um, the tread is good and doesn't wear out. Because sometimes you do have a favorite pair of shoes, very comfortable, and they last for a while, but then the tread becomes uneven. And I've noticed that because we walk sometimes asymmetrically or unevenly, so parts of the tread may be more worn out than the other parts. If that starts happening, you do need to replace your shoes. And some people say, "Oh, well, Tricia, that's, is really expensive." But I tell them that, yeah, it's expensive, but it's worth it because what's the cost of if you had fallen? The physical cost, the mental cost, the psychological cost of having had a fall because you've had improper footwear. Other habits are some of the risky behaviors that we engage in, like rushing, not being mindful, like I told you about tripping over that little um, curb step for the parking space, trying to do too many things at the same time. I've had people tell me, they carry their laundry basket with both hands going downstairs and they can't see their feet and they missed a step. So again, just we want to engage in more safer behaviors so that we don't fall because again, like I said, the personal cost of falls is really high. And I know it's hard, just like me changing my slippers. Sometimes maybe you might say, "Oh, that's a no-brainer. I can change that habit. I can change my footwear no problem." But I know for me, this habit was a little bit more harder for me to break. So anyway, so then also exercise is extremely important. So strength and balance are important in order to stand tall, lift your feet, and regain balance if you begin to trip. I think I have some samples. Okay, so we want to be stable. And I think this is one of my favorite exercise. It's called ankle circles, and you can do it standing or you can do it sitting. So you'll see the person is sitting tall, they're not slumping or slouching in the chair. And I like to tell people to do one leg at a time rather than both legs at the time because I notice when people try to do both legs at a time, trying to do the ankle circles, the quality of the movement is not as good. So you want to do your ankle circle as big as you can, as if you've got a pen at the end of your toe and there's a piece of paper there and you're trying to draw as big a circle as you can. So getting that flexibility, getting that strength in that ankle. And I tell people do 5 times one way and 5 times slow deliberate circles, 5 times the other way, and then do the other foot 5 times one way, 5 times the other way. And the reason why that this is important is that your ankle joint is the first joint that detects and responds to the change in the terrain. So if you are walking, doing your neighborhood walk, and the sidewalk might not be as smooth, there might be some cracks, tree roots that are kind of buckling the sidewalk, then you want to, if you don't see the crack in the sidewalk, that if you step on it, that your foot feels it and responds to it, that to maintain your balance. So that's why, ankle circles are really important and you can do them anywhere. Um, sitting, I do them sitting in the car, waiting at the doctor's office, watching TV. And I feel that this has really helped me because one time I was walking on uneven ground and I swear to you, my ankle really um, um, buckled. But I think having that, having the strength and flexibility to keep myself upright, I mean, it hurt like the Dickens. And I think my arms were helicoptering, but I didn't fall. And I think it's because doing these darn ankle circles. Another exercise, combining strength and flexibility, is marching. And you'll see there that you can see that you're working on your hip flexibility and knee flexibility. You can do it seated, you can do it standing, holding on to counters. And sometimes I tell people if you want to add an extra strength component, you can pick up your knee and just hold it there for about 5 or 10 seconds, and you can really feel your quads working. And that's the same with those ankle circles. I like people to do one leg at a time and hold their foot out. Don't don't rest your leg on an ottoman. Don't cross your legs. Um, Lift you don't have to lift it so high that the heel is touching the ground, but lift it enough so you start working a bit on your quads. So that's what the ankle circles. But this is good work too, strength and mobility. Oh, and this is my favorite. The research says this is one of the best exercises for balance and strength, and this is the sit to stand. And you may have heard this already. So you'll see the guy, he's standing up. And what I like to tell people when I teach them this exercise, that to stand up tall so your knees are as straight as you can. And then when you go to sit down nice and slow, as if there's an egg on your chair and you don't want to crack the egg. I mean, it's so easy to, you get to a midpoint and you just plop onto the chair. And that's just gravity bringing your bottom down. So you want to go nice and slow. And it's hard. I know it's hard. So I will tell people, we'll start off with a chair, you know, a master dining room chair that has arms. Of course, again, you don't want to have wheels on the chair, but something with arms, and just use your arms to help guide you down nice and slow to really work those quads, work those hamstrings, and work those glutes. Very, very, very important. So nice and easy and slow. And I know it's hard. So a lot of times I tell people just start off with 5 and make sure, because this is a hard exercise, to breathe. So I will tell people as they descend into the chair slowly to count out loud, perhaps 5, 4, 2, 1, gently onto the chair. So there are, excuse me, community and virtual exercise programs. There are matter of balance classes, and I'm going to talk about that just a little bit more in depth later. But your local YMCA, now, things are opening up now in person, or there's the YMCA 360. I think it's virtual exercises on demand. There's Sit and Be Fit, that's on public TV or DVDs. And um, Sit and Be Fit comes on every day at my house, I think around 9:30. And I've done them before, and they're very good. There's seated yoga. And of course, I don't want you to forget that functional activity, which includes light household chores like loading, unloading the dishwasher, folding towels. Sometimes people tell me, I'm busy all day. I'm busy doing, housework. I'm cleaning, and does that count as exercise? And it does. I count it. There's that formal exercise, which is maybe a class that you do or a program that your physical therapist gives you, and then there's that kind of informal exercise. You're walking around. You're in your garden. You're pruning. You're digging. Those are also very important, and I include that too. So here is, just in general, making changes to help prevent the falls. So talk about falls and near falls to your health provider, and be open and honest as you can. I know people who are a little fearful of telling their doctor because they're thinking, oh, they're going to take my license away, or I won't be able to live independently, or they'll tell my kids. I mean, also too, I tell people, be open with your family too, because maybe they can help you make those changes. Maybe they can help you, maybe bring down those most common items that you use in your kitchen down at an easier access, so that you don't have to climb it up and down ladders, sorry, um, or footstools. Get regular vision and hearing exams. Hearing is also very important. I mean, there was this John Hopkins study that was done that said even people with mild hearing loss, people with moderate hearing loss were more at risk for falls, because you can't hear what's behind you. Let's say if you're taking a walk. So it is, again, super, super important to get your vision and your hearing checked on a regular basis. Also, review your prescriptions. and your over-the-counter medicines, any herbals that you take, any vitamins that you take with your doctor or your pharmacist. Sometimes, I talk to the pharmacists because they're the ones that, have had the training in all these different chemical interactions and reactions. Um, so they may be the best person for you to talk to. You want to make proactive changes and home safety modifications. You don't want to wait until you've had a fall. So I'll tell you, I'm an example of this. I remember telling one of the guys at Home Safety Services that I was going to call them one day. I was going to call them and have them put grab bars in my bathroom, when I get older. And of course, and one of my colleagues said to me, "Well, Tricia, you are getting older." So, yes, make proactive changes before something happens. Again, people say, "I've never tripped on that rug," but you don't want there to be a first time. Keep your feet healthy and in supportive footwear. Don't wear flip-flops. Wear shoes that have a strap or a back in them that have good tread, and check your tread on a regular basis. Usually for a pair of shoes that you use on a constantly and you use them for walking and everywhere you go, usually I think it's like 4 or 6 months. And then you need to replace them. I guess it depends on how hard of a walker you are. And again, really check the tread because sometimes there's an unevenness there. Participate in a regular balance and exercise program. And you may have heard about this that exercise is medicine. So these are the different programs that our department offer. So the Farewell to Falls program, which is the first one that you see there on your screen, is a free home-based, multifaceted fall prevention program. It's for older adults, 65 and over, who live in the Santa Clara and San Mateo counties. And it comprises of 3 visits by an occupational therapist. So we take a look at home safety. We do a home safety assessment. We give you our recommendations. We'll look at your strength. We do strength, mobility, and balance standardized assessments and give you an exercise program. We take a look at your medications, and we will have our pharmacist do a um, a medication review, and what you will get is some paper that will say to you drugs, and they'll look at your medications, your vitamins, your over counters, everything. It'll say drugs that may increase the potential for falls, and then are there any drug on drug interactions? Are there any drug and food interactions and any kind of safety things related to medications will we put into this report? So I find that very helpful. And so those are the things we go over. I tell people that it really is just 2 visits because the third visit is a year from now. So a year later, I mean, we see the participant again. We talk about how the year has gone. We kind of do a year review, like, have you had any falls, any changes in your health, any changes in your medications? You know what? Let's take a look at your balance and strength and mobility again, using those same assessments that we did in the previous year, and we like to, compare. So this is a great program. It's free. It's been around for I guess 17 or 18 years. And initially, it was sponsored by a grant. And the grant actually did run out about 3 years into the program. But because people in the community felt that they got really good information from this program, the hospital has continued to fully fund the program, again, at no cost to people. And really, you don't have to be. Sometimes people say, do I have to be a Stanford patient? No, You don't have to be. I've seen people who have Kaiser. I've seen people who have Sutter. I've seen people on Medi-Cal. It doesn't matter as long as you live in the San Mateo, Santa Clara counties, you're over 65, and you have a concern about falls. So this is a great program. The other programs that you see here, these are community-based programs. So they are classes that we offer. So Matter of Balance, and Robin mentioned this, it's an evidence-based program that's geared toward older adults who may have a fear of falling. So what we do know is that the fear of falling is also a risk factor for falls. I mean, someone could be going on a walk with their friend and then they fall, and because they've had that fall, they might be a little hesitant about going walking again because they've had a fall. And because of that, some people may limit their activities or stop doing the activities that they really enjoy because of that fall concern. So this class takes a look at that. It includes a curriculum that's lectures, group discussions, as well as exercise as part of each class session, because when we think about what we need to, what kind of skills, I should say, we need to have in order to prevent falls, we need both mental skills and we need physical skills. So the mental skills are those being assertive, knowing what your fall concerns are and how can you change your behavior so you could be more safe and you feel more confident in doing the things that you enjoy doing. So that's a Matter of Balance. I'm passionate about Matter of Balance because I am the Matter of Balance master trainer, and I set up the community classes. So the other program that's also an evidence-based program is Bingo Size. And this is kind of fun. It is evidence-based. It is twice a week for 10 weeks. And it combines, I'm sorry, the game of bingo with exercise and fall prevention education. So there's exercise in between questions about fall prevention and fall prevention education. So it's kind of fun. There's both seated and standing exercises, and if you hit bingo, you get a prize. So I know we've offered Bingo Size at senior centers, and we've done that virtually too. So that's Bingo Size. Then the other community-based program we have is called Stepping On. And so again, another evidence-based program for older adults at risk for falls. The program has been shown to reduce falls by 31%, and you will learn about strength, balance exercise, discuss risk factors for falls, and they do have guest speakers. And so a physical therapist, a pharmacist, and a vision specialist will come in. And so after the program is done, then there's a booster session. So you'll see there the program meets for 7 2-hour sessions, and then a booster session is held 3 months later. And a home visit is also offered as a part of this program. And you'll see, we do. I'll have a bigger. My next slide will have a bigger screen, but you'll see there's a QR code, and you'll see that our phone number, if you do want more information, and our email and our web page. So we do have a quarterly newsletter that we put out. And if you are interested in receiving it, you can join our mailing list. And so the QR code is there. You can also, there's a telephone number, and again, our email and our web address, and you can get information there. At this time, I had just done attended the senior resource fair over at Mountain View, and people were asking us about classes for Bingo Size, Stepping On, and Matter of Balance. And right now we're in the process of trying to schedule those. So unfortunately, I don't have any dates right now that I can tell you where there is a class. The only class that I have that's going to start for Matter of Balance is in Belmont. So if you are interested in attending Matter of Balance, Belmont, it starts in June. So you can give us a call or email and we can give you more information, or I can give you more information if you are interested. But I think that concludes my presentation. Yes. So I'm going to stop. Oh, let's see here. Stop a sharing. Okay. And
Oh,
we're back.
we're back.
I'm back.
Wonderful. Thanks very much, Tricia. That's a great
Yeah.
presentation. If anybody has questions, please put them in the Q&A box or the chat box. A few questions had come in.
Mm.
Where in general are these community classes? Are they in senior centers or care facilities? Where are they?
Yes. So um they are mostly, sorry, my cat is now bothering me.
Oh,
Um they are at community centers and other senior centers. We've had them at residential places like I actually had a class in January at Sheraton Apartments in Palo Alto. So it depends on, whether I have the staff or the volunteers to teach that class. So we've gone as far south as Cupertino. We've had a class at the Saratoga Retirement Center and then further up north in Palo Alto, and in in San Mateo County, I partner with Dignity Health because they
okay.
offer Matter of Balance classes too, at their health and wellness in Redwood City. So I will partner with them, like Belmont, the one that the class that's coming up. I'm partnering with them, and so I think I will go as far north as San Carlos, I think. But those primarily, to answer your question, they're mostly at senior centers.
Okay, great.
Yes.
Let's see. Why do you mentioned, I think the very first slide or maybe the second slide that the number of falls has gone from one in four to one in three, uh, meaning serious falls, one in four to one in three. Why do you think the number of falls has increased?
I think it might be, there's a lot more of us, right? The baby boomer population is getting older,
Mm-hmm.
and I think that's and there's more of us, right? So
Mm-hmm.
I think that's why that's happening. And because I read something where the burden, like I was talking about the cost
Mm-hmm.
for falls, a lot of the burden is on Medicare and Medi-Cal. So I think it's because our older population is increasing that we're getting the numbers that we are. Falls happen for any age, right?
Mm-hmm.
I think it's in the pop. So from young to older, and I think there's one segment where I think in the teen population that the injuries for them is mostly in like violence,
Oh,
unfortunately.
oh,
Um,
wow.
but
Mm,
yes,
mm.
it falls happen across the board. But
Yeah,
we're more
right.
vulnerable, right? Because we
Mhm,
have health issues that might be compounded by a fall, osteoporosis,
mm,
osteopenia, you
mhm.
know. So neuropathies that could cause us
Mm,
to not, feel as steady on our feet.
yeah.
Um, Sometimes too, people like talking about those risky behaviors because I've had people say, well, I don't want to use a cane because I will look handicapped, or people are going to ask me questions, or um and you know what I say to them, I say, I see, because sometimes it's a pride thing, right?
Mhm,
I
mm,
don't want to appear old. but
Mhm.
but it's part of being safe. And it's
Mhm.
part of I always tell people, when you're walking on your 2 feet, you're feeling the ground beneath your feet. That's helping you keep steady. But let's say you have a cane, now you have a 3-point contact, and you will feel the ground beneath your feet through your hand, through your arm, through your shoulder. So that keeps you more steady. I know for me, I have knee problems, and when my knee acts up, I get a little nervous, like getting in a crowd because I'm afraid someone's gonna rush into me. So I mean, I use my cane. And
Mhm.
I try and I'm the same way. It's like, oh, people are gonna look at me funny or what have you. But when you use a cane, people get out of your way.
Mhm. Mhm.
So I tell people, try to get over that because I've heard of so many stories, like very people who are very prideful and refuse to use the walker and have a devastating fall. And then, like
Yeah.
I said, what's the cost of that?
Mhm.
So
Yeah. Yeah. Um,
yeah.
um, I mentioned this caught my eyes. You gave those three great exercises.
Oh,
And I might want to add one related to the ankle, which was discussed we had a symposium this
mm,
last weekend, and one of the talks was about orthostatic hypotension, which is a very common symptom in Parkinson's disease. And the doctor said before, and the physical therapist said it as well, but before you stand up, it's a good idea to pump your ankles. And so you could both pump them and do the circles, do
yes.
5 circles and 5 pumps or
Yes,
something,
because you want to get the circulation going, right? And that's what I
right?
tell,
Yeah.
because that's what I tell people when to take their time getting up, especially if they've been lying in bed, all night and it's time to get up and you have to go use the bathroom instead of just popping up and going is to sit up, maybe do some stretches, do your ankle pumps to get that
Mhm.
circulation going because now you're sitting upright. Before you were lying down and your circulation was going sideways, now if the circulation has to go up against gravity through your brain. And so yes, that is so important. And I always also tell people to just stand up and make sure you're steady
Mhm.
and then
Then
go to the
proceed.
bathroom. That's
Yeah.
talking about the bed. That's another sometimes a trip hazard I see in people's homes. Their comforter or their blanket
Mm. Mm.
puddles at the
Mhm.
edge of the bed, and so I've had people trip on them. So you got to be very very careful about that.
Yeah, right. Um, what caught my eye though, or caught my ears about the your three exercise was on the sit to stand. No, no, it was on the marching. You said a sit up straight, no slouching or slumping. And as a sloucher myself, I wondered, what is your justification for telling people not to slouch?
Well, I think because if you want to improve core strength, to sit up tall. But I do realize that there's some people whose balance are not so good and they need to have the support of the chair behind them. And you know what?
Mm,
That's okay. That's, sitting up nice and tall, holding your core in. I mean, that's the most optimum. But I do realize there are some people with varying degrees of, strength and
mhm.
balance. And if they need to get their back up against the chair to give them that extra support, I mean, I'm totally fine with that.
Yeah, okay, that's good. Uh,
Because talking about exercise, talking about those three primary exercises. Do you know what the other exercise or what I tell people to do is because a lot of people tell me they walk. Oh, I walk, walk, walk. I have to walk my dog, and which is a great exercise, right? But I like to tell people to, if they can, to incorporate sideways walking. Maybe they hold onto their kitchen counter or the back of
mhm,
their couch and do sideways walking back and forth, and
mhm,
even go holding on, of course, holding on to something and take a few steps backwards. Now, I know that's very difficult for people who have Parkinson's, and I would say only do it if you have somebody with you. But it is a nice thing to also incorporate this balance forward,
mhm,
sideways,
mhm.
backwards. into your strength and balance routine. Because I mean, sometimes we have to be able to incorporate that backwards, because let's say you go to the bathroom and you've got to open the door and you might have to take a few steps back to get into the stall. And
Mhm,
some people are really, a little hard. It's hard doing
mhm,
that. So I say, or let's say you go to the farmer's market, you look at the fruit, somebody comes next to you, you got to move sideways, and then somebody wants to pay, and then maybe you have to take a few steps back. And if your body is used to walking sideways and doing a little bit of backwards, it's going to feel more comfortable doing that. And maybe you'll
mhm.
get a little bit more confident. But I
Yeah,
do know, I do want to say, I don't want people to walk backwards without not holding on to something.
yeah.
Yeah, yeah,
So we have one support group member, as I recall, his physical therapist suggested going slowly, going up and down stairs and to face the rail. So both hands are on the rail and very slowly take one step up, the next step up to next foot up right beside the foot on the same stair, and similarly keep repeating that. And this seemed like a very good exercise because not only is it stairs, but it's also that sideways motion you mentioned and safe
yeah,
because you're holding on with both hands.
yeah, yeah. Because I mean, I've had people tell me, I mean, they're okay going up the step, but it's going down the steps where they're a little bit more nervous. But yes, I
Hmm.
have recommended some people to go sideways. And um, if the step is long enough, right, to accommodate
Yeah.
their feet, sometimes
Yes. Right.
you get steps that are like really narrow.
Yeah.
Um,
Yeah. Indeed. Indeed.
yeah.
You mentioned falls, and another term you used was near falls. What is a near fall?
A near fall is because, well, let's talk about falls. What's the definition of falls? I think of falls as an unexpected meeting with a level that's a little lower than what you started off at. Okay. So
Hmm.
a fall, and so sometimes people say, "Oh well, my fall it was kind of a fall," but then they will describe something where, "Oh, I tripped over." What did this guy tell me today? He tripped over his stationary bike foot handle, and he found himself on the floor. So, but that's a fall. That's not like, but a near
Hmm.
fall is if you trip, you had a trip or a slip, but you were able to catch yourself. Let's
Hmm.
say the wall was next to you and you were
Hmm.
able to catch yourself on the wall or on the table or on the chair. But sometimes I know of people who say, well, if that wall or if that table or that chair wasn't there, would you have met the ground?
Right. Hmm.
Sometimes I've had people feel that that's a fall. They consider that a fall,
Hmm.
because if that wall wasn't there, they would have been at a level lower than what they
Hmm.
started off at.
Hmm. Right. Okay. And someone asked, what is the best way to get up after a
Oh,
fall?
I love that question, and I'm glad that you asked it because I didn't have it in the presentation. But sometimes falls happen so quickly, you don't know what happened. You don't have time to. Sometimes people ask, how do I fall? But if you have fallen, the very first thing you want to do or not do is pop up. I mean, 80% of falls that happen are usually non-injurious, but it's that 20% that you've got to be very careful of. So what you want to do is you want to make sure that it's okay for you, that you're okay, that okay to get up. So because I had one lady actually that who told me that she was at the senior center in Avenidas in Palo Alto, and she fell, and she felt really embarrassed, and there were people around, and her daughter was there, so she told her daughter, help me get up. But what she didn't realize, and I think she was running on adrenaline, is that she actually fractured her femur. And
Mm.
then in getting up, she told me, yeah, the surgeon told me because I got up, I displaced my fracture a little bit.
Mm.
And so the surgery was a little bit more complicated.
Yikes.
So,
Mm.
so that's the thing. Again, usually there's no problems. I mean, I had a friend who fell at a wedding and she told me, and people are uncomfortable about you being on the ground as well as you
Mm.
might be embarrassed. And they rush in to grab you and pick you up. And she told me those guys, there were strong guys there. They wanted to grab her and get her up. She said, no, 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 no. Don't touch me. Just call 911. And it was a good thing she did because there was a fracture here in her clavicle and she needed a plate and pins put in there. So can you imagine if they had gotten her up, how much more, would have been a problem there. So
Yeah.
first of all, take stock.
Mhm.
I know it's very jarring.
Mhm.
And so just sit there for a moment and move your arm around, move your leg around, kind of move your head. And if you feel like, and your body,
Mhm.
if you feel like, oh, you know what, something's not right, then it's best to get 911 and get the professionals to
Mhm.
get you up.
Mhm.
So while you're there, and if you feel okay, I'm going to get up, if somebody's there with you, see if they can bring a sturdy chair to you. Okay,
Mhm.
so you don't want to kind of get up without holding on, but have somebody bring a chair. If you're by yourself, get yourself, or crawl or butt scoot yourself to a chair. Or I had one lady tell me she scooted herself to the bottom of her stairs so
Mhm.
that she was able to get her bottom up to the step, and get herself settled. So you want to have a sturdy chair, not a chair with wheels. um, get on your hands and knees or butt scoot yourself to the chair. Put your
Mhm.
hands on the seat of the chair. And if somebody's there, maybe they can kind of hold on to your waistband and hold you up, but try to use your legs um, to get yourself up. And you don't even have to stand up all the way, but kind of crouch and get on the chair. And whew, do I need
Mhm.
to go to urgent care or ER? I'm just shaking. Do I just need to kind of take a breather? And sometimes, again, like I said, most falls are non-injurious, but it's that 20% that we want to get really um, uh, get help for. And again,
Mhm.
if you feel like you try to get, because there's a lot of people who can't get up, it's like, call 911. I mean, well, it wasn't me, it was another therapist who told me that the wife fell, husband tried to get her up by holding on the arms and trying to
Oh,
bring
uh-huh.
her
Yeah.
back. But their hands slipped and she
Oh.
fell back down. She was okay. But because of the momentum, he was the one who got hurt. So, you don't want to hurt the people that are trying to help you. You, and if you are able to help yourself a little bit up, but if you can't really please call 911. Yeah,
Mhm.
but that's the
Mhm.
biggest thing. Sometimes I'll tell you, I was at a shopping center in the parking garage, and there was a lady who fell at the curb outside Nordstrom's because she was talking to her friend and they didn't notice the curb step in front of them. And there was no chair around, and I'm not gonna make that lady crawl to the bench, but I was able to get in a half kneeling position so that she put her hands on my lap, and my husband was on one side, her friend was on the other, and she got her legs underneath her, and we went one, two, three, and up. And so
Mhm.
sometimes if you have people who are willing, if you're able to direct them the best way, you don't want them to do a total lift, or nor do you want to pull them, but there are different other ways to do it. But the biggest thing is using a chair.
Yeah. Okay, great.
Yeah,
One
yeah.
thing we did with my dad
Mm,
fell quite a bit, and fortunately, never any serious fall, no
mm.
injuries but falling is very upsetting to
Uh-huh.
both the faller and to people around. It's a very
Oh
upsetting
yeah.
situation. And my dad would be very shaken up. And one thing we would do is just lie down on the floor. I'd bring a pillow for him and a little blankie, and we would just lie down on the floor and rest until he
Hmm.
felt he had some energy
Yes.
to try to do the crawling. I think there's no if you're at home or in a private situation, there's no harm in resting
No.
before you try to get up.
Yeah, I've had people do that. Yeah, they're at home and they just cut they because it is such a devastating event
Hmm.
thing that happens. I know for me, like a couple years ago, I fell outside a neighbor's house because there was uneven pavement, and I recall I fell forward and I didn't have the time to put my hands out. I hit the ground with my face, really, and I could
Mm-hmm.
see the ground coming,
Oh
and
my gosh.
I couldn't do anything about it. Thank God I didn't break my glasses or my nose. I mean, I cut my lip, but I remember sitting there, and my husband said, "You want to get up?" I go, "Let me sit here for a while."
Yeah,
You know,
of course.
it does really shake you up. And so
Yeah.
I've heard of that where people, you know what, let's get comfortable, let's kind of lay here for a moment and
Yeah.
relax. And
Yeah.
when the body is ready, yeah,
Yeah.
yeah,
Yeah. Especially because I wasn't able to physically lift my
yeah.
dad.
And
And
you should. No, I don't want you to.
yeah, no, and so it
I
was good. And later on, after he was rested, then I was able to direct him to help him roll over, get to his
nice.
hands and knees, and then crawl. And so we
Yeah,
did
nice. Yeah, so
with
that's good
him.
that he was like that because sometimes people are so embarrassed or they
Yes.
feel humiliated. And so they
Yeah.
feel like they feel compelled to get
Yes.
up and
Yeah.
say, I'm okay. But
Hmm.
you
Hmm.
know, you shouldn't do that. Yeah.
Yeah,
Yeah.
yeah, indeed. Let's see. Are there any more questions coming in? I will ask maybe one more of my own. If not, you mentioned stairs, and of course, stairs can be quite dangerous. What's
Mm.
your thinking about when chair lifts or any of those sorts of things for stairs? Do you like them? Do you not see a point to having them?
No, I like them. I mean, if you need it to be safe and you want to be able to stay in your own home,
Hmm.
I think I think go for it. I mean, they are expensive to install, but if it's you kind of have to weigh, staying in your own home versus, you know, being somewhere else. And if you are able to have it, I would say go ahead. I mean, I saw a guy who he was a veteran, so they were able to put the chairlift in for free, but it was the way their house was, it was only like 4 steps, but they
Mm,
put that chairlift anyway. So I've seen chairlifts, for small stairs. I've seen for big stairs, and it's an energy saver too,
mhm,
because the energy component or your breath or to go up those stairs, sometimes having that chairlift helps them to have the energy to do the
mhm,
things that they enjoy rather
mhm,
than getting tired from going up and down the stairs. Oh, well, some people will tell me I go down the stairs and I stay down for the
mhm.
rest of the day and then I only come back up if I go to bed. But yeah,
Yeah,
you do kind of have to weigh,
mhm.
if you want to
Yeah,
stay in your own home and improve your energy level too.
yeah.
Yeah.
Okay. Well,
Yeah.
one of our attendees wants to share very small joke, a short
Oh,
joke. Okay, when
oh,
a 7-year-old fell on the playground, he was asked by his teacher, "What do you know? What do you think caused your fall?" And the child said, "Gravity." Ha ha ha.
oh. That's
So
that's very cute.
very
Very
cute. So
cute.
on that note, Tricia, we will thank you for your excellent
Oh,
presentation and appreciate so much your telling people about Farewell to Falls and all of the community-based programs that Stanford offers. They're just terrific. And oh, and I should say, you mentioned that the community-based classes, the only one that you have scheduled
oh,
was the one in Belmont in June, but Farewell to Falls is
oh,
anytime. People can
yeah.
call you anytime.
It's anytime. And again, as long as you're in the San Mateo, Santa Clara County.
That's right. Wonderful. Great. Thank you so much.
Oh,
And we'll see
thank you for
everyone next
having me.
time. Yeah, appreciate it.
Yeah.
Great. Bye,
Okay.
everyone. Have a
All
nice
right. Take
afternoon.
care,
Bye
everyone. Bye
bye.
bye. Stay safe. Stay up vertical, upright.
Vertical. Yeah.
All right.
Bye.
Take